Hey, my name is Colin, and today I'm going to talk about how the shortage of healthcare personnel affects the delivery of care. Staffing shortages affect the well-being of the workplace. The number of doctors and nurses present also affect the patient safety and quality of care delivered. It is more expensive to run a hospital when it is understaffed, and shortages of staff actually occur all over the globe now. The healthcare workers of today are faced with many challenges. With the rising population, this results in the higher use of our healthcare system. With this, it's becoming common that the medical staff is faced with longer hours, additional shifts, and a higher workload. The additional hours and workload result in burnout and job dissatisfaction. This in turn leads to lower morale among staff as well as increased rates of absence from work. Researchers Goodell, and Van S. Koling found that there is a correlation between how job satisfaction and job performance affect the quality of care patients receive. Healthcare professionals that are stressed by the high workload can exhibit poor job performance, which can result in errors or missteps. These errors can threaten the patient's safety and well-being. When the workload is high, this can get in the way of proper communication and collaboration not only between staff, but also with patients. This disruption of these two factors impacts the delivery of patient care, which then threatens the organization as a whole. While nurses are just one part of the healthcare team, showing an example regarding the amount of staffing in that position is critical to understanding how it impacts the entire hospital. Nurses are considered to be the backbone of the healthcare team, and not only do they provide direct care, they also communicate crucial information to the doctors and other caregivers. That is why the effectiveness of communication between staff is vital to the organization as a whole. When understaffing of nurses is occurring at a hospital, studies show that a higher percentage of adverse patient outcomes occur. A report titled The Effect of Healthcare Working Conditions of Patient Safety reviews over 26 different studies. In these studies, the Evidence-Based Practice Center found that there is a link between low nurse-to-patient ratios and high rates of non-fatal adverse outcomes. The findings from the studies previously stated show that in hospitals with high nurse staff, patients had lower rates of adverse patient outcomes such as UTIs, pneumonia, shock, gastrointestinal bleeding, and longer hospital stays than did patients who were being treated in hospitals with a lower amount of nurses staffed. Higher staffing at all levels of nursing was also associated with a 2 to 25% reduction in adverse outcomes, with the percentage being dependent on the outcome. It was also found that a high nurse-to-patient ratio results in lower instances of pneumonia during stays. Results showed that in critical areas like the NICU, infections are lower when the department is not experiencing staffing shortages. While these only focus on nursing, shortages of doctors, technicians, researchers, and other healthcare professionals also impact the delivery of healthcare to patients. In the years 2004 and 2005, registered nurses, physicians, CNOs, and CEOs participated in a survey on shortage of nurses and their ability to provide care. The question posed to the healthcare professionals was, from what you know, how much of a problem do you think the shortage of nurses has been for each of the following? Quality of patient care, time for collaboration with teams, ability of nurses to maintain patient safety, early detection of complications, nurses' time for patients, and quality of nurses' work life. An overwhelming 91% of nurses felt like a nurse's time for patients was a major problem, with 78% of physicians agreeing, and while smaller, CNOs and CEOs agreed with 66 and 59% respectively. Additionally, 78% of registered nurses, 61% of physicians, 64% of CNOs, and 54% of CEOs all reported quality of patient care to be a major problem. Finally, it's also important to point out that 82% of nurses reported their work life to be a major problem. As commented on earlier, stress, burnout, and job fatigue of healthcare personnel can have dire consequences on patient care, which in turn impacts the overall health and fitness of the hospital. Staffing shortages can cost a hospital in a number of ways. The first and most obvious could be a malpractice claim. Errors made by tired or stressed healthcare professionals can lead to inadequate patient care, creating a need for the patient or loved one to file a malpractice suit. These types of claims aren't just a monetary issue, but they can tarnish the reputation of the hospital and the healthcare professional. Turnover in personnel is another problem for a healthcare manager. Hospitals spend a lot of money to find the best personnel, bring them on board, and train them in their way of doing business. According to nursingworld.org, the cost of recruiting and replacing a registered nurse is 1.1 to 1.6 times in annual nurses' salary. High turnover rate can also hurt patient care, which in turn hurts the bottom line of the hospital. Lastly, as mentioned, shortages of hospital personnel lessens the time with the patient, which means problems may not be detected as early as they should be. This not only can lengthen the hospital stay, it also means personnel and resources are needed to address a problem that might never have existed if proper staffing levels were being attained from the onset. Departments such as radiology, pathology, and other departments can experience delays running tests and reading scans that may not have been necessary if staffing needs were addressed and delivery of care was adequate. The shortage of healthcare personnel is not only a problem here in the United States, it is a problem many countries across the globe are facing today and will continue to face in the future. According to the World Health Organization, the world will be short 12.9 million healthcare workers by the year 2035. In the year 2013, the shortage was only 7.2 million. While the most dramatic shortages are in underdeveloped countries, this is still a problem for the entire world to address. Countries across the globe are experiencing a graying of their populations, increasing the number of people seeking health care, crowding hospitals and waiting rooms. Universal health coverage, while having benefits, also puts a strain on the healthcare systems of many countries. Also, many doctors and healthcare professionals are nearing retirement age, and the pipeline of new personnel has not reached the level needed to maintain adequate staffing levels. It is important to focus on creative strategies to bring skilled, bright minds into the healthcare field and ensure health administrators are strategizing to retain them on hospital staffs. Planning is an integral part of any hospital success. Planning is an activity that should never cease. It's a continuous process and necessary to operate at maximum efficiency. It aids each department of the hospital in its operation, development, and improvement. Staffing is one essential area that requires endless thought and planning. This means that staffing does not just impact the hospital from a monetary standpoint, it also impacts patient care and ultimately the reputation of the hospital. Managers use a strategic plan to improve the problem occurring within the hospital. The plan is to come up with a short and long-term goal. A short-term plan is up to a year, and then anything after that is considered a long-term plan. For example, a short-term plan would be hiring temporary staff while looking for long-term employees. Supervisors mainly focus on the short term first, but sometimes are required to put work into the long-term plan. In some cases, the long-term plan may need work immediately. Why is planning important? Planning is one of the most crucial parts of a hospital administrator's job. Planning in a hospital setting has far-reaching effects. Not only must you plan for your staff, you also must plan for your patients as well. Managers must operate in a cost-effective manner while not compromising patient care. This is critical when it comes to utilizing the hospital's resources and reducing waste. However, it is more critical when it comes to the vital resource of personnel. Doctors, nurses, technicians, pharmacists, housekeepers, and the vast number of professionals in the hospital all have a critical role to play. Personnel costs are a huge part of the hospital budget, and planning must be done to ensure all the moving parts are in place and able to provide the quality of care expected by patients. When it comes to coordinating, integrating and balancing the short, intermediate, and long-term plans are crucial to staying organized. It's recommended that the supervisor coordinates with the subordinate managers to ensure that the plan is explained and understood by them and their departments. The most effective style of planning consists of making a set of objectives or goals. My main short-term objective would be to address the understaffing problem by locating temporary staff until we have been able to recruit the proper level of permanent staff. This could be done through temporary employment agencies. It could also be done by utilizing past hospital personnel. For example, an employee may still possess all the proper credentials, but simply took time off to raise children, care for a sick family member, or decided to retire. While not willing to work full-time, they may be willing to commit to a short close-ended time frame. The long-term goal, though, is to retain the current staff. As hospital administrators, we know there are easier healthcare positions out there to be found. We have to develop strategies to be competitive when it comes to retaining staff. So first, we would ensure that the employees are paid a highly competitive wage and are offered a high-value family healthcare package. Next, the goal is to ensure employee morale stays high. This will be done by allowing employees the necessary time off to rest, be with family, and come back to work ready to serve patients. In addition, we make work with an employee pool, whereas employees with school-age children would be on a team together and would coordinate extra time off during school breaks or in the summer based on personal schedules. Hospitals are a 24-hour operation. In order to ensure proper staffing levels are maintained, we should have a rotating on-call list of employees to cover shifts at each different position. Nurses are an integral part of the hospital. According to the American Nurses Association, hiring more registered nurses could actually cut U.S. costs by $3 billion, which would be the result of about 4 million avoided extra stay days for adverse patient outcomes. To competitively recruit more registered nurses, we would offer a signing bonus and pay for their continuing education. In addition, the signing bonus would be utilized for other skilled positions with shortages such as hospital pharmacists,